Here is a detailed, heading-by-heading comparison of Gaucher disease and Fabry disease, covering 15 key differences. 1. Type of disorder. Both Gaucher disease and Fabry disease are lysosomal storage disorders. These are inherited metabolic conditions in which defective lysosomal enzymes lead to the buildup of toxic substances within cells. However, the specific substances and systems involved vary significantly between the two. Enzyme deficiency, Gaucher disease, caused by a deficiency of the enzyme glucocerebrosidase, also called glucocerebrosidase, which is needed to break down glucocerebroside into glucose and ceramide. Fabry disease results from a deficiency of alpha-galactosidase A, an enzyme that breaks down globotriaosylceramide, GB3 or GL3, into simpler components. Hasher-3, substance that accumulates. Gaucher disease, the lack of glucocerebrosidase causes glucocerebroside to accumulate, particularly in macrophages forming Gaucher cells. Fabry disease, the deficiency in alpha-galactosidase A leads to the accumulation of globotriaosylceramide, GB3, in vascular endothelial cells and many organs. 4. Gene involved, Gaucher disease, caused by mutations in the GBA gene located on chromosome 1. Fabry disease, caused by mutations in the GLA gene, which is located on the X chromosome. Now 5. Mode of inheritance, Gaucher disease, inherited in an autosomal recessive pattern. A person must inherit 2 defective copies, one from each parent, to develop the disease. Fabry disease, inherited in an X-linked recessive pattern. Males are more severely affected because they have only one X chromosome. Females may be carriers or mildly symptomatic due to X inactivation. 6. Gender predilection. Gaucher disease affects males and females equally since it's not linked to sex chromosomes. Fabry disease primarily affects males severely. Females can have mild to moderate symptoms depending on the degree of X chromosome inactivation. 7. Ethnic prevalence. Gaucher disease. Type 1 is common in individuals of Ashkenazi Jewish descent, though all types can affect any ethnic group. Fabry disease, rare across all populations with no strong ethnic association. 8. Organ involvement. Gaucher disease primarily affects the reticuloendothelial system, especially the liver, spleen, and bones. It may also affect the lungs and in types 2 and 3, the brain. Fabry disease, a multisystemic disease that affects the heart, kidneys, skin, nervous system, and eyes due to widespread endothelial involvement. 9. Bone manifestations. Gaucher disease, bone pain, osteoporosis, bone crises, and avascular necrosis, especially of the femoral head, are common. Bone marrow infiltration is also frequent. Fabry disease, bone issues are not typical features. The skeletal system is generally unaffected. Last 10. Skin manifestations. Gaucher disease does not cause visible skin abnormalities. Fabry disease, characterized by angiokeratomas, small, dark, or purple, raised skin lesions, often found in the lower trunk area. 11. Neurological involvement. Gaucher disease. Type 1, no central nervous system, CNS involvement. Type 2, acute neuronopathic form with severe neurological symptoms in infancy, usually fatal. Type 3, chronic neuronopathic form with progressive CNS involvement. Fabry disease presents with neuropathic pain, especially in the hands and feet, acroparesthesias. Patients may also develop stroke, dizziness, tinnitus, and hearing loss. 12. Renal involvement. Gaucher disease rarely involves the kidneys. Fabry disease frequently affects the kidneys, leading to proteinuria, progressive renal insufficiency, and often end-stage renal disease, ESRD. 13. Cardiac involvement. Gaucher disease, uncommon, though mild cardiomegaly has been reported in some cases. Fabry disease, common and serious. Patients may develop left ventricular hypertrophy, arrhythmias, conduction abnormalities, and valvular heart disease. 14. Eye findings. Gaucher disease. No specific ocular abnormalities are associated. Fabry disease. Eye signs include corneal verticillata, a whorl-like opacity in the cornea visible on slit lamp exam, and posterior spoke-like cataracts. These do not usually affect vision. 15. Treatment and prognosis. Gaucher disease. Enzyme replacement therapy, ERT, with imiglucerase, velaglucerase, or talaglucerase beta can effectively manage symptoms, especially for type 1. Prognosis is good for type 1 with early treatment. Types 2 and 3 have a poorer outlook due to neurological decline. Fabry disease, treated with ERT using agalsidase alpha or beta. Chaperone therapy, e.g. megalostat, may be used in selected cases. Prognosis depends on early diagnosis. Organ damage may progress even with treatment, especially in untreated males. Thank you. Have a nice day.